Welcome, everyone. Here we are at the Brand New England 2021 Annual Conference. Another year has gone by since we transitioned into a virtual conference format. How many of us thought that we'd still be living in a pandemic? Not me, but here we are, and what a year it's been. We do hope your families have stayed safe and healthy. We have a great day ahead of us full of information and fun. We have a fabulous group of people here today to share expertise and insight from their areas in the rare disease space. We'll learn about several resources available to patients and families, and we'll hear about the challenges and achievements of medical providers, patients, and patient advocacy organizations as they dealt with the COVID climate, along with already complex rare diseases. We'll find opportunities to meet each other and chat, and so much more. We do hope you'll enjoy the day. Let me share a few things that we have today besides the awesome presentations. First, we have a raffle and two great prizes for two lucky winners at the end of the day. First prize is a Yeti cooler priced at $200, and a second prize is a $100 Amazon gift card. The raffle will be open throughout most of the conference, but will close just after the afternoon break. Tickets are $10 each, but there is a great deal of $50 for 10 tickets. Please use the PayPal link to purchase tickets. This link can be found on our webpage, conference page, and in the email that you were provided that shared conference information. Be sure you get your raffle tickets soon, and good luck. All proceeds will benefit RNE's efforts to assist the rare disease community. How many of you are the competitive type? We're also having a gaming activity with more great prizes. Many of the conference activities you participate in will stack up points for you automatically. You'll be able to watch the leaderboard in the lobby to see who is gaining and if you are falling behind. At the end of the day, the top 3 people with the most points will win a fantastic prize just for listening to awesome presentations, joining the friendly networking rooms, and visiting the wonderful exhibitors. But when you visit the booths, be sure to check out the videos, documents, and links. First prize is a gorgeous chenille scarf, a pair of handmade earrings, and a bottle of hand lotion. Second prize is a fall basket full of fall treats. And third prize is a $50 Amazon gift card. So be sure you check out all we have to offer today at our event. We want to thank our exhibitors for being a part of our day. They have lots to offer and resources and are looking forward to chatting with you. Visit our exhibiting room and say hello. Several of our sponsors are exhibiting too, and will be thrilled to see you. Be sure to check out the conference brochure. You can find it in your email, but it is also linked within the conference platform. You will find lots of info within it, including the conference agenda, speaker bios, and topics. Information about resources from our sponsors and participants of our Rare Disease Dazzle Ad offer, and more info about other Rare New England programs. Please remember to complete your conference evaluation by the end of the day. We really appreciate feedback and use it to improve our programming. Each individual voice matters to us, and you could find this survey in your informational email and within the conference platform. Please join the networking rooms when you can, especially during breaks. We have 3 networking rooms available today. One is showcasing our program, Career Affairs and Medical Genetics, and has a recording available to show you what we are doing for medical students to learn more about genetics. You can meet the host, Dr. Mark Corson, and committee member Hannah, and ask any questions you have about this program. Another networking room is showcasing the world of rare disease and has a sampling of the many fabulous recordings we have up on our YouTube channel. As you enter, you can meet Lisa, host of the show, and learn more about watching. A third networking room will be for us all to join and meet each other, and has pics of some of the events RNE has done in recent years. Each break will be hosted by a couple of R&E board or committee members. So come say hello. We want to meet you. If you have any tech concerns, please click on the info tab in the main lobby and Jeff or Eden will guide you along. If you need to reach me at any time during or after the conference, email me at julie@rarenewengland.org. Now, as they say, let's get on with the show. Good morning, everyone. I need to mention that one of our speakers, who is here to speak on legal matters, is not able to join us today. She apologizes and she hopes to be able to join us in a future event. We are happily filling the time with hearing even more from Erin from the Patient Advocacy Foundation, who has a great deal to share. I've been a personal fan of the work of the Patient Advocacy Foundation for quite some time now, so I'm really happy to be able to introduce you to Erin. Please remember that if you have any questions, to write them in the Q&A box, and we will be reading the questions at the end of the session. Erin Bradshaw is the Chief of Mission Delivery for the Patient Advocacy Foundation. She provides leadership in the design, delivery, and oversight of the case management division to ensure the achievement of the organization's philosophy, mission, goals, and objectives. Her 23 years experience with PAF has been spent improving patients' lives around the nation. She will now share who this organization is and what they do. Welcome, Erin, and thank you for being here today.
Thank you. So do you want me just to share my screen so I can bring up the presentation, or is it best for you?
You can share your screen. That would be great.
Okay. Let me. Okay. Can everyone see the slides?
Not yet.
Not yet. Okay. It is showing.
There we go.
Okay. Okay. All right. Welcome, everyone. It's a really a great opportunity for me to join you today. And as shared earlier, I'm the Chief of Mission Delivery for Patient Advocate Foundation. I am really just really happy to join you all. I have a little history that I thought I would share because there's a unique connection from, the fact from New England, rare disease. And, I myself am from the New England area. I was born in Massachusetts and lived the majority of my life between Massachusetts, New Hampshire, and Maine, where my parents have retired. So it's a pleasure to be here. So today, I really want to just share with you all of the services that Patient Advocate Foundation offers. And also we have a very specific targeted rare disease care line that I'm going to spend some time as well. So we're going to talk about what we do to help patients and caregivers and professionals, and also how we teach and provide advocacy support through education and empowerment and training. Our mission has really never been more motivating than it is right now. We have been providing case management services for 25 years for Americans with chronic and life-threatening and debilitating diseases. We were founded in '96 when our founder and co-founder really experienced some challenges that often is addressed by many patients that face any kind of health condition. So we've really designed and created operational models and delivery of certain services based on what we're hearing from everyone who calls us, just like you might. And so our case management is the foundation of what we do, but over the years, we have designed and have opportunities that offer other support services, which I'll be sharing with you today. So I'm going to give a quick overview of Patient Advocate Foundation and our services last year. So as you can see, we've served 192,000 patients, 629 different diagnoses, with 246 being very distinct rare diseases. In this chart here, we have broken down all of the different types of services that we offered with the volumes and really how we've been able to provide some impact. At the end of the day, knowledge, professionalism, and our ability to provide a level of support and help reduce some stress is our key goal here. And our patients do agree by giving us the service ratings that they have. As I shared earlier, we have a robust amount of services that we do offer. Case management is the one that I'll be talking about soon. I'm going to address the financial aid funds and our copay relief program, as well as some educational collateral that we have. But we also have a health equity and community engagement element that is extremely important to the organization as one of the core foundations of what we do, meeting people where they're at when they need us most. Also, patient impact and ensuring that we're continuing to meet the goals and the objectives of what you all need, but also how we can be the most successful for you. And then we do offer a special event where we raise some funds through one of our annual galas, which we just had great success with. And in that event, we raise funds for Scholarship for Survivors program that allows us to provide grants for those that are going to college who have been impacted by diseases. Right now, the application process is open, and we have a very difficult job with reviewing all of those deserving applicants to select those candidates. And then the other element that we do a lot of is health services research and patient experience evaluation. We learn and we're able to model and hopefully make some change on what we see and what our data tells us. What is the most important elements for you? What are some of the pitfalls and challenges that we're noticing from organizationally around change that has to happen from the insurance aspect to benefits to all of those pieces? So with that being said, we do have a sister organization called National Patient Advocate Foundation that was founded at the same time as Patient Advocate Foundation. While Patient Advocate Foundation is based on direct intervention and providing support as needed at the time and the moment, our National Patient Advocate Foundation is really about making change and movement and helping try to define and support those for longer impact. So how do we help? How can we help you and those that in your loved ones? This is a little more detailed about case management. So we are an organization that's about doing our best to get the positive outcome. While we realize that not everything can be resolved, we are very critical thinkers and help walk through some solutions that we can hopefully get to the end goal. As you can tell on this slide here, we have a broad range of types of diagnoses that we serve, and the top 10 are listed here for you. On average, our cases are open about 12 business days. Of course, that fluctuates depending on the severity and the support need. If we're helping someone navigate through a health insurance denial and appeal, that would be much longer, whereas if someone needs some guidance around finding some financial resources, that might be shorter. But we are not subject to just providing you a bunch of referrals and sending you on your way. Our goal is to really help kind of dive into the depths there and provide that level of engagement. So over the 21,000 patients that we served in 2020, we had over 300,000 different contacts that we made to get to some sense of resolution. Here is a chart of our demographics. We are not specific to any type of income guidelines, employment status, or insurance status. To us, we want to help you if you have support needs. And we do recognize that situations, especially with diagnosis of any kind of health condition, that these can change around employment and income. I think one of the things I do want to point out is that we do all know, and the reason why we're sitting on a virtual event today and not sitting in person is that we've had a very unique shift in what has occurred within the pandemic. But I also think it's been a result in some notable aspects that we have seen as far as patients that have had insurance and no longer do, as well as their employment and that where they have had a loss of employment and benefits to them unrelated to their health condition, but simply based on the challenges that we faced as a country. Case management, our case managers come from all different backgrounds very intentionally. What we provide for you is very comprehensive and covers a whole host of different support needs. And so with that, we have different skill sets that we want to onboard to provide that level of engagement. They, we're about meeting you, providing compassion and empathy, and helping you navigate those top financial and social concerns, and then guiding you to safety net programs. As you can see, we have a collective of 387 years of healthcare background prior to or joining the organization. Diversity and inclusion is extremely important for us. And we have had lots of referrals that come from nonprofits, friends, and families, and other organizations. We encourage that. And as I share this presentation, I'm going to open some opportunity to have for you to ask me questions too, so we can kind of get into that level. Here's a list of our case management programs and partnerships. As you can see, it's very robust. The services that we offer are always around the same core competencies, but what we've done is we've been able to extend our reach and support other organizations, as you can see on this slide, to add that element of support through a direct intervention, complementing the services that they offer, so that we can continue to meet people where they're at, how they reach them. This is just a simple slide. I think it's a great demonstration of what we do. So our approach to supporting patients is to understand and ask a lot of questions around the pressing issue that has generated the outreach to the organization. We're focused on ensuring that you have access to prescribed care and also the financial means to do so. We take a helping hand, we take your hand and actually lead you to it. And so what this demonstrates here is the types of issues that we are focused on. So we have, I would say, the majority of the phone calls tend to generate around a financial impact or concern that has elevated a situation that has come to light. So if we were talking to a caller and we recognize that there's a medical debt concern or the inability to pay, or maybe a roadblock in able to pick up a medication or get access to a necessary surgery, we're going to help navigate through those barriers. We also want to ensure that the insurance is covering what it should, that you have ample coverage, that we can overcome any kind of denials or lack of payment structure. And then we understand too that many patients have employer-based protections and work entitlements. So we want to ensure that all of those things are covered as well. So any kind of protection while on leave, or benefits like disability or health insurance coverage, because if you transition into a place where you have to have a leave of absence, or even from a patient perspective or caregiver perspective, excuse me, these are important elements to know so that you tap into them at the time. In addition, cost of living challenges, the financial aspects of your health condition that's coupled with some of these other areas of a reduction in income, or just the simple added cost associated to your care, might impact your ability to afford your basic cost of living or your nutrition, your utilities, your housing. And when you couple this all together, emotional stress or financial stress around these scenarios are real, and we want to provide that level of engagement and help. So we hope that we can at least provide some support to alleviate some of those pressures while helping you navigate that. This slide is just identifies what I just shared, and the other one in a little more textual area. We're about reducing financial burden. How do we do that? We find resources and help you apply for those elements. We look at loan forgiveness programs and deferral opportunities. We want to connect you to emotional support groups, or evaluate your health insurance plan around what coverages you might have if that's a need, as well as nutritional or wellness. Assisting with you applying for programs like short-term and long-term, as well as identifying any kind of appropriate health insurance, charitable programs, or social programs. That might even be something that's not even quite forward in the front of mind, but as we talk to you and learn what your goals are, we might realize that maybe a plan change would be best to expand your network, or you're in open enrollment period. Like right now, we're in the Medicare open enrollment period, and it's a great time, even if you're happy with your health benefits, to evaluate what it is, ensure that they're going to maintain what they are for the coming year, look at your current treatment plan and treatment needs, and make sure that they're going to still fall within that plan structure, and then evaluate. and pick the one that's best for you. And we're also moving towards the open enrollment period for marketplace plans. If you are in one of those benefits, November 1st, that needs to be part of your thought process as well. And so, again, I'll open up some opportunity at the end if we have some specific questions about that. But I just wanted to call it out since it is definitely an area at the moment that we're in. The other thing too is we understand the financial aspects, the insurance design or lack of can create some hurdles around your premiums, your deductibles, or lack of coverage, and what kind of charitable events are there, hospital support, provider support, copay programs. And then, of course, if you were to run into a hurdle and you're prescribed a particular treatment or a regimen or protocol, and the insurance company does not necessarily agree with that and is kicking back with a denial, a prior auth, or a denial post treatment, we provide that support with navigating through that level of appeals guidance, as well as supporting with other elements of if you're questioning how a bill was paid and if it doesn't look accurate, is there a coding and billing challenge? And then we all know within rare disease that you might need to see a doctor that might not be laid out in your plan, and how that out of network or second opinion needs could create some hurdles for you. So we're here to help. This is this is a patient we helped. She actually was diagnosed with a rare disease, thyroid eye disease, and called us when she was prescribed a therapy that was going to save her eyesight. When she called us, her insurance company had denied it, and they were not willing to provide that level of treatment need based on what they considered medical necessity and experimental investigational. And you may or may not, those are common terminologies, but we helped kind of engage with her provider and designed and put together a letter of support with an appeal package with clinical evidence and some background and and support to show that this was truly a medical need. And then we expedited it based on the fact of how fast her vision progression was, and we're able to overturn that. And what she shares here is just a beautiful picture and just gratitude of how we've helped her. And I think the comment that really comes to me is immediately how her eyes started to improve. And she says, I felt like a flower that had wilted, and when finally given water, started to grow towards the sun again. This is really just a reflection and appreciation that we have for when someone returns back, how we've been able to help, and shares to others too. So I mentioned earlier, so our case management program, as I shared, is a very robust program. We talked a lot about the different areas that we provide support in, but we have a specific program, the Rare Disease Care Line. It's a very targeted program. We understand that there are unique challenges in the rare disease community. We still cover the same areas, but we're very sensitive and have been since inception around that. We know that it sometimes takes a really long time to get to diagnosis, that there aren't a lot of standard of care protocols, and that you might run into challenges around off-label indications, or what they consider experimental investigational or non-standard therapies. And so with that, we also recognize that there's a lot of travel associations, or you have to go to facilities far away, and so there's financial impact to that. But so we're here, and I just want you to have this information and know. So Patient Advocate Foundation, our website is patientadvocate.org. Here on this slide, we have our dedicated landing page, but you can find that from that shorter one that I've told you. Our phone number is 800-532-5274. We're open Monday through Friday, 8:30 to 5 Eastern Standard Time. The online opportunity is on our website, and that is available 24/7, and then we follow up within 48 business hours with you. So I'm going to go into our financial services so I can go a little more detail on that. And I've closed up the case management. So over the years, we have heard from people like you. And of that, we have also identified that there are financial needs that continue to evolve. And so with that, we have designed different programs that offer financial grants to patients that need them. Now, I'll say that these are different than case management because they are reflective of financial need and also based on the funds that are available to you. So you would need to go to each one of them and look into see if they fit have the guidelines and the open options to select. And so while I'll be sharing with you today, I just want you to know too, through case management, we also kind of evaluate that and know that not only our organization's funds, but if there are others to connect you to. So these are our financial aid program is a small grant program for low income patients that offer a broad range of like non-medical expenses. So think of the food, transportation, housing, and short term. We had over 85,000 patients receive assistance last year. We were very fortunate to partner with an organization called Team Rubicon that was helping patients who had nutritional gaps during the pandemic. And so that also brought a significant increase of those that needed help around certain diseases. But we were grateful to do that. You can see one of 3 patients participating in our pandemic survey reported a hardship. So this is something we continue to put in for grants and funding opportunities, and we know how much value there is for that. Currently, these are the programs that we have available. We have the Angel Fund and the Leash Line Financial Aid Fund. Those are connected to those that have sepsis, toxic shock, or ARDS. A lot of health conditions do present and can cause infection, and sepsis might be connected, but they're targeted to helping individuals that have had the unfortunate diagnosis and impact of that to help provide some financial relief around some basic cost of living. The Donna Financial Aid Fund is connected to breast cancer. The Mahan Financial Aid Fund is connected to acute myeloid leukemia and the Merkel cell carcinoma, Merkel cell. And again, I encourage you to continue to look at this site because they do change. And the link is patientadvocate.org/financial aid. Or again, if you just go to patientadvocate.org, it will bring you to all of the things that we're talking about today. Our copay relief program is a program also born out of the case management data and showing us that the shift of financial responsibility associated to the copay, coinsurance, and cost sharing to qualifying patients was an absolute need. And in 2004, we launched this program, providing that relief to insured patients that qualified, alleviating some of those expenses around their pharmaceutical treatments and admission of. We have hundreds of different copay programs, and they change on a daily. So I encourage you to look at copays.org. Again, you can connect through our main landing page, but that's the direct connection to see what's available for funding if you qualify and what they are. They're constantly evolving. Some of them offer premium assistance as well. And we also have some support around COVID-19, genetic and genomic testing. So I really encourage you, if there's a need around that, that you evaluate that. So here's the eligibility. So it ranges between 300 and 400% of federal guidelines. That's depending on each fund. We do adjust that based on a cost of living and a zip code. So it's not reflective of what you would see on like the federal government around guidelines, because it's important for us to recognize where you live and the cost of expenses. So there's a process behind that. Again, I shared qualifying diagnoses, and you must have active health insurance to qualify. And what the fund covers are all the therapeutic and supportive prescribed medicine, include anything, generic, brand, biosimilars, as well as the office visit of any kind of therapy that you might have had that needs to be administered at the office, and such. This is just a list that reflects all of the diseases in which we have open for funding. That does not mean that we have funding for them. Okay. And so I talked earlier, I think patient empowerment and education is a huge component to what we feel is important. We want to help you, and we're going to be there for you. So please call us and help us support you. But we also want to give you some resources and tools. You might be a consumer that wants to navigate those things themselves or learn more about a topic or concern. We recognize that as when you have a diagnosis, and especially living with a rare disease, that there are elements that are just going to be important that might have never even crossed your mind. And so over the years, we've continued to evolve and grow our resources connected to those practical and financial support elements that we know that are so important. We infuse our case management knowledge in those little tidbits of information to make them, very unique outside what you probably could get elsewhere. There are so many organizations outside of us that we also lean on and garner from their resources as well. But we have publications, and we have short training sessions. We have one that's on how to uncover a denial and how to appeal. So you can learn how to do that. We have the importance of picking health insurance during open enrollment, a financial resource directory that will lead you down potential resources based on your age, your diagnosis, the area that you live in, the type of support that you need. These are, like I shared, just continue to grow because we feel that complementary assets to the work that we're doing just provides that level of engagement that hopefully makes you more of a consumer of your own health and gives you the education that often is unknown at the time. I don't know many people that just pick up their health insurance plan and read it, understand what that means, and recognizes how to use it. It's not until you tend to run into a situation do you realize that there might have been a restriction or a barrier or simply a benefit design that you might have just not understood. So again, just encourage you to look at that if there's an interest to learn a little bit more about us and the educational elements that we have. So with that, I want to thank everyone for allowing me to share an overview. I will stop my screen, and then if there are questions, I'd be happy to answer them.
Yeah, thank you, Erin.
Yes.
That's a very nice overview. And I know you guys do a lot more than what you've shared this morning. So I hope that they do take a look at the website and see what else you have available. But in the meantime, we do have one question here. Do you have advice for resources of navigating public insurance or purchasing insurance if they need to leave their employment for some reason? I know personally, I am always concerned that an insurance plan will not cover a lot of the excess services I need to manage from my rare disease.
That's an excellent question. Yes, we do both. So we have a lot of resources on our website that talk about this too, but we can also have a conversation with you, especially if it's just exploratory and you're trying to figure out what your options are. We do have the marketplace plan, which we, through the Affordable Care Act, which we didn't have for years ago. So as you're transitioning out of employment, you don't always have to elect COBRA, which was a continuation of the benefits that you have as long as you fit within those guidelines of eligibility. But there usually was a significant cost associated around that because you're paying the full cost of the premium plus an administrative cost and could sometimes be cost prohibitive. It's something you should consider and you should look into because this is an option, but you can also explore the marketplace options available to you based on searching by your zip code and what available they are. I think that it's important for what's important to you. And I think that's probably the most part. I will just call out that couple pieces to keep in mind when you're looking at them is the networks and the type of design that they are. If you want expanded access versus a narrow network, just those are key elements, types of medications or treatments to look at the formulary and pay attention to the premium and your out-of-pocket expenses. So don't base your decision on the premium alone because that might not be reflective of the true financial impact because you want to look at what is your your deductible, your out-of-pocket maximums, and kind of look at and assess that to make sure because we have noticed that the reduced premium there might be some more cost and the back end or a narrow network. So I think that's like a very generalized statement for you, but you certainly can. And it's considered an open enrollment period. So a special open enrollment if you're transitioning out of an employment and you don't have to align within the open enrollment periods that are already established with the marketplace because you have a certain period of time to do that because you've had a shift. So the other thing I'll just call out real quick is depending on your marital status, if a spouse has insurance, it might be an option to consider. And again, that's a special enrollment period because of a transition.
Mhm.
Mhm.
Let me ask you, because, and you're correct, there are a lot of people, they look at some of that, that information for the new enrollment, and, it's a lot of information to take in, and it's not always easily understandable. Where's the best place would it be the insurance company, or are there something like Patient Advocacy Foundation where you can go to kind of help you to figure out if the changes that they're making are going to work for you?
So there are lots of advocacy organizations that provide support just like us. We can help. I will tell you that our ability to search for benefits will be, um, you know, we don't want to, we're never going to tell you which one's best for you because we're going to guide you. So we're going to ask you a lot of questions, try to get some foundation, and then look at what they're there to try to give you kind of a narrowed down consideration, and what's really important. The online tool that's on healthcare.gov will let you do those things too. You can log in, you can put in some your zip code, and look at benefits too. They do comparisons, so you can do a breakdown. You can call, and then if you see one and there's not um, information that you can't find that's targeted to something you need, you can call the specific insurance company and ask the question too, if that's not clear, because you're not going to see you're going to see your the basic outline in some parts, and you should be able to search different medications, facilities, but network, negotiation takes place with the providers too in hospitals, and um, hopefully there's not a transition, but sometimes there will be a transition of providers and not that come out later too, that even were part of the review in the beginning. So, but yeah,
Mhm.
I would say that if it's something that you really want some guidance and support, we're absolutely here to do that for you and just talk it through. And sometimes it's just that, like, we can have a conversation and guide you and cover, or we can do more engagement. It's really dependent on where you are, and we don't have to stop there. Like, we could talk about it, and then when it comes time, we come back at it and see what's offered.
Mhm. No, that's very helpful. It's always good to have somebody to go to talk to about these things. I had a personal experience actually where an insurance company decided they weren't going to pay for a medication because it was now approved as over the counter.
Mm,
And there are a lot of people in the rare disease community who take a lot of over the counter medications. And, when you add those prices up, they have to start not taking them. So, it is a problem out there. So another question we have, what does it take to be a patient advocate? Do they go through training?
so it would probably vary depending on the organization and the definition of advocacy. We are a type of work that we do is very engaged into the health insurance, disability, and some of those elements of billing and financial. So we are looking for patient staff that have had some kind of usually background in one or those areas, but also just have a desire and compassion to support people and help lead them. There are critical thinking, empathy, compassion, knowledge base, willing to learn. And so there are, like I said, there's so many different levels of advocacy. We have our National Patient Advocate Foundation side actually has a volunteer network, and they have that you can join. That's about, really kind of boots on the ground, trying to help make awareness of these services are offered, but also, help make change. So if there is maybe a bill's coming to place and they want to talk about, the one recently was about surprise billing and transparency of costs, they might activate the volunteers to go on the ground. And so there is a whole level of training on that's around how to be an advocate and like what that looks like. And it's a little different angle than what we would do, that's more knowledge based and driving people. So there are advocacy certifications that you can take. There are even college advocate, because it's such a growing and important element of what you do. Social workers are a different level of advocacy, and financial counselors in the hospital. So I know that's a broad answer, but I could tell you what we look for when we're doing it is really just that skill and just the ability to kind of think through critical thinking and help someone. And we're telephonic too, so it's important to have a real ability to communicate, listen, and that's and kind of circle back and listen and provide feedback and follow through.
Mhm. Thank you.
Mhm.
All right, so here's one. Need urgent assistance in getting dental care where current dentist refuses to send referral to a specialty department at Tufts Dental School. Who can do the work safely for me? Tufts requires a referral for them. Can PAF help with this, as this is a health-related dental issue?
So dental coverage with health insurance is a challenging area. I think I would have to understand a little bit more, and certainly can connect with me um, to get a little more detailed so that I can figure that out and triage it accordingly. So I will throw my email in the chat and there because sometimes if it's a medical associated, and my dog's going to come up and visit, sorry. um, so if it's a dental scenario that's considered health related, sometimes we can get that evaluated under the insurance. But even in cases where people need excessive dental for, like say we've had cancer patients that need to have a bunch of dental work before transplant, it has been not very successful with finding a solution. So I hear a couple things in there about a referral and maybe some network and dental. So just go ahead and shoot me an email if you don't mind, and we can kind of assess that.
Yes, thank you.
Yeah,
I know this is kind of it's a frustrating
it
scenario
is.
for many people.
It's super frustrating, and it's very counterproductive. But it's unfortunately the design, and then health, and then as you have dental benefits, they don't have great. They have a limitation, so usually can cap out of what's there too. So it's frustrating, but there might be some means in which we have resources or discounts or working with charitable type dental if it's appropriate that might help.
Mhm. Okay.
Mhm.
Oh, here's an interesting one here. Do you have any job openings? I am looking for a role in advocacy and have some experience.
We actually are, but I will say that we are Hampton, Virginia based. So that might, depending on your location, we're sitting in New England, that might be a narrowed thing. Again, here's my email if you want to shoot me a resume. Right now, I'm not familiar with any 100% remote, because while we are remote because of the pandemic, the plan is to return to the office November 1st. So, but hey, don't rule it out. I'll take a look.
It's good to hear, though, that there are more people who really want to get involved in this and help others.
Yeah, and there might be another opportunity elsewhere, or maybe even that volunteer aspect that I talked about. So, yeah.
Okay. Do you work with Big Pharma for grants available for prescriptions not covered by formulary?
So I'm going to think that this means, do we help provide support around getting access to that? Or, so there's a couple things we do in that scenario. So if it's off formulary, we want to try to argue that with the insurance. So it would be ideal for us to go down through appeal path and provide the clinical evidence and get it covered. So that it's not considered that. And then there are sometimes opportunities when the pharmaceutical companies that offer charitable assistance if you qualify, and some of them have guidelines. So we might have to actually do the appeal and get the outcome, or if you already have the denial, for it to be considered for you to get that access to you. Because I understand, like, this is a big deal within the rare community too, because that's often what happens. And until clinical evidence can build, we see that a lot. So yes, and I guess it just depends on what you've already done and what it is that we can do to help you.
Is there a cost for this advocacy service?
There is not. We are a free service to you.
Which is wonderful. And someone has asked, what is the volunteer group? Is there something that if anyone's interested, they could reach you through the email?
Yeah, do that. And that way we can connect, and then I will make that connection for you. So that I would say it's pretty open. I mean, there's some guidelines around what they're kind of looking, for you to be supportive of, and there's different levels. So certainly.
Mhm. Mhm. Okay.
If you could do
And
me a favor and put your, like, what your ask is in the email, so I that would be helpful, because that way I'm sending you all to me.
right, right. Could you speak a little bit more about, I know your organization has helped people with disability, with
Mhm.
issues with disability, and this is a huge area too in the rare disease community, and trying to get disability when they're unable to work. Can you
Yes,
share a little bit on that? Elaborate a little bit what you do and how you help them?
absolutely. So we're going to assess your disability needs. So, if you're coming to us and you're looking to get support with disability, where are you? Have you applied, or are we talking it through? Are you denied and we're going through an appeal? Because that's going to help us drive that. And then based on that, we're going to have to figure out what is the best direction to go and if there are options for you. So I say this because if you're unable to work and you've had a shift of situation, you really want to, and you're working, look at what you're entitled to. What benefits do you have already? So do you have a short-term disability plan, a long-term disability plan, any of those? Because you want to tap into them and apply. A short-term one is a little less arduous and typically will align within what your doctor says for treatment, but it's short-term. A long-term plan is looking for something that is going to progress and have obviously a long-term support need. So they might be a little more particular and stickler around what they're looking for guidelines, and we might be able to help with that. Some employers have both, one or the other. And so that's the thing. And then I'll say, if that's not an option, or we're still moving into like a Social Security evaluation, we have to look at you and your unique guideline of how you fall within that plan. So social SSA actually has an option where you can log in, create an account, and it can tell you based on where you are now, if you have enough work credits or you don't, if you were to be disabled today. So that would be, it's like a great opportunity to kind of explore and see, because this will make a difference. So if you are somebody who's looking at Social Security looks at someone whose disease progression or their disability is going to exceed 12 months or more. So that's a big key component. So they're not necessarily contesting that at the moment, or your treatment scenario isn't a disability, but you have to fit that mold. So then they're going to evaluate you and say, okay, well, which if you apply, not only do you fit the guidelines of disability, but do you also have enough work credits to get SSDI, Social Security Disability Income? If you do, then that's the one where it pays you a monthly stipend based on eligibility and it has no income elements. If you don't, then they look at supplemental security income, which is called SSI, and that is simply based on need. So it's two things. It's, do you fit the disability guidelines, and do you have financial need? And that is very subjective. And I'll say, because you can't have more than $2,000 in assets. You can't have an income over X amount of dollars. And I don't want to misspeak that one because of that. And they're going to look at spouses and anything. And so that's where it can get slightly frustrating for some that have maybe not had that. They've been a caregiver, a stay-home parent, or maybe they're not old enough to have accumulated enough credits. And there are other elements too. So I'll just kind of throw out there, like if you're an adult, like a child transitioning to an adult, or that's a whole different discussion, because you might have opportunity to get off your parent and things like that. So, but that's really what we have to do, because once we understand that part, so if we can then, if there's a matter of a denial, then okay, why? And then we need to start building some evidence through your providers and charts, and like to help you construct an appeal. I will just give one word of advice. If you are applying for a disability plan, especially Social Security, you're going to want to make sure that you are complete and comprehensive as much as you can be, because the more information you give at the beginning, the better your outcomes are. And the length between the different levels of appeal. And even when you get to like an administrative law judge, which is one of the last ones, you could be, in theory, years. And so they're so backlogged and they have that stuff. That's why I say, like, let's get it there. So it might be your rare disease, but what if you have other health conditions? You want to list all your doctors, all your medications. You want to talk to your providers. Do they support you? Alert them that you're applying so that they look for the paperwork that are being sent by Social Security to get your medical records. If you have them, supply them because it helps. So anything that you can do to help kind of like ensure, don't assume that just because you put an application in that everything has gone as planned. Things get lost, faxes come on, machines that get mixed up. They might not get the letter of request of medical records, and then there's unnecessary delay. So that's my biggest word of advice. So
Thank you for that. I
yeah.
appreciate that. That's some great information. We did have a few more questions come in, so let's see if we can get to them before our time is up.
Okay.
So we have, are there limitations to those who can receive services? Is it just for low-income individuals or anyone with a chronic illness?
So our case management services do not. It's for anyone that needs support. And we have a bucket of, chronic disabled and life-threatening, which, all rare disease falls within. It has to be around the core competencies that we're familiar with. So the ones that we shared around, your insurance, employment, and, financial aspects. The financial programs do have eligibility guidelines based on their design. So the copay programs and the financial aid fund. So not only the disease itself is connected to, but also your income asset, income element. And they also, copay has an insurance component too. Case management can help look at resources external to what we offer internally for PAF, but most financial based programs have that kind of component to them.
Thank you. Do you have any information or experience on the ABLE accounts? I recently heard about this.
I am not familiar with that, so I'm not going to be able to, and it might be just something that I'm not picking up from an acronym standpoint. Sorry. Yeah.
I could be wrong. I think that's something that the disability attorneys or special needs attorneys, actually, I think they can handle a question like that. So I'll try to share that with the person who, answered the question. And I can actually hook them up with someone who I believe does do that. So we can work with that. So that's good. Well, this has been very informative. I'm really happy to have had you. As I had said in the beginning, I've been a fan of Patient Advocacy Foundation for a few years now. So I'm really happy that we were able to have you here. Maybe you might like to share with everyone what the process might be if they do want to approach, because otherwise I think you're going to get everyone's emails now.
Yeah.
Email, but
so,
what should they do?
Yeah, so that's a great follow-up. So there were some questions today that, of course, I directed you to me, and I just wanted, because we've had the conversation, it's best for me to kind of help navigate you. But if you are just seeking our support and need our assistance, the best way to go there is, like I said, patientadvocate.org. And then our toll-free line is 800-532-5274. And then if you go to patientadvocate.org, we actually have, it says case management, there's a little button that says case management, copay, whatever. So whatever you're navigating to, but there's also says connect for services on the top of our banner that drops down our case management services deeper that has all of our programs listed and the rare disease, but there's an actual get help button. These are those online abilities that you can create your own referral and send in and just give us some basic demographics about yourself so we can get a little more specific in the overarching issue or concern that you have to help triage, because that's important so that we connect to the right staff member, and that bypasses you having to call in. So what happens when you call in is you're actually met by a medical intake specialist. So that's our first line team that's just going to get some demographics from you and kind of understanding what your support needs are and evaluate that they fall within our organization and what we can help you do. And then they'll let you know that they're going to triage to our case management team and then follow up with you. So like I said, so it's either the online that way or the verbal aspect that you can do that. And then someone will follow up with you. And at that point, they'll go into a lot more detail. They'll learn more about you and in your situation, and kind of grasp, what you had originally identified, but also, think about it and see if there are other elements that might be supportive as well to kind of drive you the right path. So that's the typical protocol. Of course, I'm, that's your best met for to get the most, triage, and I will direct anybody that emails me that has some support needs, that once we talk, if that's it, I'll probably push you that way too. But when we were talking about some of these specific areas, it's just easy for me to kind of help vet you and just help you understand what's happening. It's hard in a chat. So, but you certainly, I had Julie, I had shared a flyer with you. I don't, that could be easily provided to your audience if that also has all that information too, for the rare disease Caroline, if it's appropriate. I can also send it to you if I don't know. Yeah.
You could send it to me. I can make sure that everyone gets it.
Okay. Yeah.
That'd be great. Yeah.
Of course.
Yeah. Well, Erin, thank you so much for being here today. We really appreciate it. Yeah, you kicked off the conference in a great way. Thanks so much.
I appreciate it. All right. Take care, everyone.
Hi, I'd like to take a few minutes to say thank you to all of our 2021 program sponsors and donors. Such generosity has enabled R&E to offer some fantastic programs full of education, information, and support to many living and working in the rare disease community. We at R&E feel proud of your support for our efforts and hope you are pleased with our work. Let me share a little about what we've been able to accomplish with the help of your sponsorships and donations. First, thank you to everyone who is a part of today. We have a fabulous lineup of speakers here and ready to share the wealth of their insight, their ideas and resources, and all that makes life better for all of us in the rare disease community. It's days like this when everyone comes together that really helps us grow in knowledge and find support that helps us in challenging times. Thank you to our 2021 annual conference sponsors. Next, we have the Rare Disease Day Speaker Series. This year, we were able to bring presentations to 11 medical institutions, including hospitals, medical and genetic counseling schools across New England. We spoke to over 682 physicians and medical and genetic counseling students about several different rare diseases, where they heard an overview of a rare disease by a physician and also the patient experience by a patient or caregiver. We realize they may never see a patient with the particular disease we brought to them that day, but they still walked away with valuable insight that may help them better understand patients in the future. Thank you to our 2021 Rare Disease Day Speaker Series sponsors. Our Career Fairs and Medical Genetics program is going well, and we have had over 119 medical students register for at least one fair in 2021, with 2 more sessions to go this fall. Trying to address the genetics workforce shortage, R&E holds these events to help pre- and medical students learn more about a genetics career. We invite geneticists in the areas of biochemical, clinical, and laboratory industry to share about the roles they play in genetics so that medical students will learn more about genetics as a career choice. We reach a good assortment of students, as you can see on the chart. And since we went virtual, we have been able to reach students in medical schools across the country. Thank you to our 2021 Career Fairs and Medical Genetics sponsors. The world of rare disease has had a busy year, and our host has been able to interview some amazing people in the rare disease space. We have quite an assortment of recordings downloaded onto the Rare New England's YouTube channel, offering information about specific disease states by patients and caregivers, resources by organizations, and much, much more. We hope everyone will check out the channel. We thank all of our sponsors for their support for making this information available for the rare disease community. We have a new program that started in the spring of 2021, Rare Connections, a set of 1 hour long virtual support groups for patients and for caregivers held each month. We all know how important it is for patients and caregivers to find support, to have a safe place to go to talk with others and hear others' experiences. It is so special to simply be in the same room as someone else who understands. Thank you to our 2021 Rare Connections sponsors. To everyone, past and present, RNE thanks you for your support over these past 5 years for all of our programs and efforts. We couldn't do it without you. Thank you. Okay, everyone, we're going to take a break. Please use this time to take a look at the networking rooms and go and visit the exhibitors and browse the idea of the raffle. We'll see you again. How about if you chime in about 10:44? Next program will start at 10:45 sharp. Thanks so much. See you soon. Probably see you in a networking room.